Let's perform trach care and trach suctioning. So we're going to do trach suctioning first because we're going to possibly make a mess on the patient's chest, and we want to get all the secretions out and then clean up. So you don't want to do trach care and then trach suction. Always suction first and then clean last. So the first thing you want to do is assess for the need for suctioning. So how do you know your patient needs to be suctioned? Well, first, they may have difficulty breathing in and out of their tracheostomy. You can see secretions that are blocking the airway there. We need to listen to lung sounds to see how they sound because they may have low pulse oximetry readings. So we want to listen to see if they are congested. Okay. So you're going to listen to the chest. Okay, and you hear crackles and a lot of just phlegm and congestion in the upper airway. So that is your need for suctioning. Apply your pulse oximeter to the patient's finger because we're going to need to monitor that during the whole procedure. Now we're going to hyperoxygenate. So you're going to take the trach collar and turn that oxygen all the way up, all the way, 15. You're going to pre-oxygenate, okay? And apply a linen saver. Keep the clothes clean. Okay. So we're hyperoxygenating. You're going to make sure you have your suction equipment ready. So here we have a portable suction machine, and you want it to be between 100 and 150. You want to have your trach care kit, your suction catheter, and some sterile water or normal saline, whatever your facility has available. Open your saline and have it ready to go. Okay. Make sure you've washed your hands and all of that stuff you do before you do any procedure. So we're going to look at the tracheostomy care, the suction first. Okay. Open this up and discard your outer paper. Inside the trach catheter kit, you'll have a little box. Okay, pull it out just like that on the bottom of the box and pop it open. You want to keep the inside of that sterile, so don't stick your fingers in it. Okay, place it right there. Pour your saline in from the side. Now you're going to open your sterile package. Apply your sterile gloves. So I'm just grasping the cuff here to separate them. And hold them off of your working space so you don't touch anything. Okay, so pull that down. Hold that thumb out. Okay, missed the finger. Now I can touch sterile to sterile. Okay. Okay, grab your package and it's your catheter. Just going to hold this right here. This hand's going to be a dirty hand. This hand's going to be the sterile hand. And I'm going to grab my suction machine. And plug it in. Not touching that blue part, keeping that sterile. Now I'm going to turn on my suction and I'm going to test it. So I'm making sure that I'm at 1 to 150. Occlude to suction. Okay. So I'm a little low, so I'm going to go up. Okay, so I'm about 150 now. Now I'm going to test I'm going to moisten the tip of my catheter by applying some suction. Pull out slow so you don't fling your catheter. You can drop that paper. Okay. Keeping my catheter sterile. Okay. Now, wrap this up inside your hand so it doesn't fling around and become unsterile. Now, remove the oxygen source. Unwrap. Going to insert curved like this till you meet resistance. Okay, resistance, intermittent suctioning on the way out, and a little twirling of the catheter. No more than 10 seconds on the way out. Okay, wrap your catheter for a second. Apply the oxygen. Check on your patient. Clean your catheter. Okay, wrap that catheter back up. 1 minute on oxygen, making sure your patient is recovered first, that they are sufficiently oxygenated. Remove the oxygen source. A second pass. Resistance, intermittent suctioning on the way out, no more than 10 seconds, in a swirling motion. Okay, wrap that catheter up, hyperoxygenate, clean the tubing, and turn off the canister, and now your suctioning is done. So that is that part. Do this with a suction tube. Keep it inside your gloves. Okay, discard. Wash your hands. Check on your patient. Now we're going to move on to the trach care part. Open up your container. All of these things are different, lots of different brands and supplies. So you have to just work with what you get. Okay, first thing on top is sterile gloves. So we're going to take out the sterile gloves here and put them on. You have a drape. You usually use this to prep the table. So put it right here. Don't contaminate your gloves. Touch the inside of your canister and just pop it there on the side. So you have, this container comes with more sterile water. I already have one opened, which you should already have one open, or you'll end up having to do it with one hand, and that doesn't work. So we have a fenestrated drape, fenestrated gauze here. I'm going to lay that right there on my sterile area. I have dry gauze. I'm going to put 2 dry on top of that, and I'm going to put 2 in here to wet. This box comes with hydrogen peroxide, which is usually no longer recommended to use on trach care, so I'm just going to drop that to the side. I have some cleaning tools, and I have a necktie, which most places use the Velcro tie, so I'm not going to demonstrate this version, which is just the regular tie. So I'm just going to discard that. Okay, Q-tips. I'm going to put put them in here for cleaning. These tools are used for reusable cannulas. So lots of places will reuse the inner cannula and clean them. So if you have a cannula that you have to clean and put back in, that's what these are for. But we're going to apply a new one. So make sure that you have a cannula that you've opened prior to beginning this part of the procedure, because you want to pick it up with a sterile hand and put it in a sterile fashion, so it doesn't contaminate the patient's airway. So we're going to apply. I have a dirty hand and a clean hand. So my dirty hand is going to put water in my cleaning tools, okay? And now you're going to remove the oxygen source, dirty hand, and take out the dirty cannula. Okay. Discard it in your trash area. Pick up the sterile cannula with your clean hand. Okay, curved down. Put it in. Okay. The sterile part is complete now. Remove the dirty dressing underneath the patient's stoma. And now you're going to take your Q-tips. With the Q-tips, you can get closer to the stoma. You want to go in and out using one at a time. In and out. Starting at next to the stoma and going out. Okay, then use your gauze to clean the rest of the area. So in and out, discard from the inside out, discard. Now take your dry ones and dry. That's the wrong one. Dry in and out, dry from inside to outside. Okay, so that cleaning part is complete. Now we're going to apply the new fenestrated gauze and change the ties. So to change the ties, it's one side at a time. So I would have my new one and put it in. Okay. So never leave one side unattached. Put it in, come around to the other side, take one side off, put one side on, and you're done. So then clean up your mess. So some things you need to know about trachs also is that you need to make sure you perform oral care when someone has a trach. So you can use these little mouth brushes to perform oral care in the mouth. Recheck the patient after you have done your procedure. Look at their O2 sats and reassess their lung sounds. Okay, they should sound nice and clear now. You want to make sure you reapply the oxygen source. And for safety, you want to make sure that you have an extra trach kit in the room, that you always have suction ready and available, and that you have an obturator. So an obturator is this device that comes with the trach. It's to help installation of the tracheostomy. So what you would do is remove the inner cannula, put this in, and then reapply the trach if it accidentally comes out. Then remove this and put the inner cannula back in. So you always need to have an inner cannula, especially if you have a really flexible trach tube that the patient has. That way, in an emergency, you can reestablish the airway. You also want to make sure that you have an ambu bag available in the room in case your patient needs artificial breathing done for them if they do not recover very well from the trach suctioning. That way, you have all your safety things in place. So that concludes your tracheostomy suction and care skill.